Good morning. My name is Don Garlitz. I'm a licensed consultant with First West Benefit Solutions. I'm here today as a guest of Cook Martin. We're grateful to have the opportunity here to present to you as clients of Cook Martin. Our firm deals with employee benefit solutions. We deal with corporate health plans and corporate retirement plans. And I've been deeply engaged along with one of my business partners in the development of a new insurance marketplace in Utah called the Utah Health Exchange. My business partner sits on the risk adjuster board for the exchange. He is the chairman, and I am on the advisory board of the exchange. And we're here today to give you an idea what the Utah Health Exchange is and how it can benefit your business. The exchange is really built around the idea of defined contribution, which is you offer your employees a defined allowance of money to buy a health plan, and they go out themselves and buy the health plan that best suits their needs. Those health plans are purchased with the same tax advantages that you would have on your health plan today, and there are dozens of plans available in the marketplace. And when your employees pick their plans, you do receive one single point billing each month for all the plans that your employees have selected. There are over 60 plans available in the exchange from the 4 insurers that you see listed on the slide. And the products that are available in the exchange are across a broad spectrum, from anything from low deductible traditional style health plans with office copays and copays for pharmacy and so forth, all the way up to high deductible health plans that can be used with a health savings account or an HRA, health reimbursement arrangement. Some of the advantages you'll experience as an employer is you'll have really an easier time in the future budgeting for your health plan. Because there are 60 plans and a variety of insurers out there in the marketplace, you won't feel the same pressure to match the rate renewal of any given plan. So you can really, with that defined contribution, set a budget you can live with and move ahead, and it makes your long-term forecasting for benefits budgeting easier. It may also make it easier for you to recruit employees, because your employees will have access to pretty much every hospital and doctor in the state through one plan or the other. And so it's a great consumer choice marketplace, and you'll still have sort of those golden handcuffs on your employees, because everything in the exchange is based on group insurance. You're getting group rates, and your employees will really be tied to you to some degree. Now, there is some portability in the exchange. If an employee works for one employer that is in the exchange and then leaves that employment and goes to another employer that also is using the exchange, then that employee can take that one plan, or in other words, enroll in that same plan when they go to their new employment. So that level of portability is attractive to the consumer or the employee. Here's some of the basic market rules. Your employees will be eligible if they work at least 30 hours a week. The exchange doesn't permit carve-outs at this point, so some employers that wish to insure, say, only their highly comp people or only their management staff or something like that, the exchange doesn't work very well for that purpose. But if you're willing to allow all of your employees that are working 30 hours a week to be eligible for your health plan, this could be a great solution. It does serve employers from size 2 to 50. And if you want to come in and put a toe in the water in the exchange, you'll need to get started about 90 days before you want your coverage to be effective in starting the process and going through the steps. There is a 75% participation requirement in the exchange, but you can ignore any of your full-time eligible employees that are covered on group insurance elsewhere. So if they're covered with their spouse, you don't have to worry about those folks. They don't count against you. But when you get down to the rest of your employees that aren't covered on another group, 75% will need to join the exchange in order for your group to be eligible. You also have to make sure that 75% of your employees are in Utah in order for the exchange to work for you as an employer. There's no contribution minimum. As an employer, you can put in any amount that you want. The system is web-based, so applications and enrollments are both conducted in an online format. And you do need to provide some kind of a pre-tax mechanism, such as a cafeteria plan or a health reimbursement arrangement as an employer. If you're working with a broker, which we would hope you would do in this system, they can help you walk you through how you get all those documents put together. You will select a default plan for your employees, so that if open enrollment comes and your employees haven't chosen a plan yet, they will be enrolled automatically in the plan that you elect as your default plan as an employer. And you do have to use the Utah Health Exchange exclusively for group health insurance. You can't have another plan alongside this. So really quickly, the process is you register in the exchange as an employer, then your employees fill out a health risk evaluation or an application to the exchange. That information is then sent to an underwriting team in the exchange, and they set a risk factor for your group. Then they issue rates for the plans in the exchange for your review. You review those rates. If they look attractive to you, you join the exchange by setting your defined contribution amounts and selecting your default plan as an employer, and then you can open up the system to open enrollment for your folks to choose their plans. Shortly after that, you get your first invoice and away you go. So it's a very great process. I serve, as I mentioned at the beginning, on the advisory board of the exchange. Part of our task as an advisory board is to make sure that consumers are having a great experience in the exchange, and also that operationally the exchange is working well. And we are also working on various transparency initiatives in order to give the consumer the most information they need to really drive a consumer-based insurance marketplace. So again, grateful to be a guest today with Cook Martin. My name is Don Garlitz. You can reach me through contact. You just look us up on our website, and my contact information is there. Please reach out if we can help you. Thank you very much.